My name is Paul Frandsen, and I am the Medical Director with UHS Pro and the Digital Bioscan Plus system. The Digital Bioscan Plus system is a non-invasive system that at its core involves a quick 8-minute test by a certified technician. The 4 widely used tests within the Digital Bioscan Plus system are the ankle brachial index, the pulse wave velocity testing, the sudomotor testing component, and finally the heart rate variability cardiac autonomic reflex testing, or Ewing's tests. The Digital Bioscan Plus system uses these broadly accepted tests in a variety of fields and brings them into one location for you in your clinical setting with your patients. It allows you then to look at a detailed clinical assessment of the patient's cardiac, autonomic, metabolic, and sensory health. There are over 60 clinical studies and peer reviews that have validated the testing parameters, protocols, and how they relate to the therapeutic and diagnostic benefit to your patients. The tests used within the Digital Bioscan Plus system in looking at the validation studies rate highly in terms of their sensitivity, their specificity, and their broader applicability to patient populations. These 4 tests compiled and used in the Digital Bioscan Plus system are comparable in their reliability and in the way the tests perform compared to other more time-consuming and costly ways of obtaining the same data. At the completion of this 8-minute testing, the patient and clinician will receive specific and targeted recommendations regarding diagnostics and therapeutics. These recommendations are based on the clinical guidelines found in the medical literature. The Digital Bioscan Plus system provides a report that involves very detailed analysis of each test that was done. It will then compile those details into a broader score within those 5 categories. Then, the last page of the report will compile all of that data, compare it to clinical studies and guidelines as relates to each of those test profiles, and give you a very specific and detailed therapeutic and diagnostic approach that you can discuss with your patient. The value of this is that you are able to very quickly compile the evidence found in thousands of hours of clinical studies and validation studies as they relate to each of these tests, and take all of that data obtained in a very quick fashion in your office and then use that data in a very targeted way to help your patient in their treatment plan. As you become more familiar with each of the tests done as a part of the Digital Bioscan Plus system and how they have performed in population studies and specific patient studies, you can then harness the power of each of these tests that have been validated and target it specifically to your patient and how they performed on the variety of testing done in that short 8-minute segment. With the Digital Bioscan Plus system, you have a battery of tests that will bring to your fingertips as a clinician both early diagnostics and late diagnostics in specific disease processes that will then allow you to implement a therapeutic plan that both involves reversal of the disease process and further evaluation of advanced disease processes that require immediate attention.